Okay, let's go ahead and get started. Good morning, everybody. I'm Marla McDade-Williams. I'm the Deputy Administrator for the Division of Public and Behavioral Health. For those of you joining on the phone, if you could remember to mute your line and to not put us on hold if you need to take another call or do something else, just to go ahead and disconnect your line and then dial back in when you've concluded your business. For everyone in the audience, both here in Las Vegas and in Carson City, if you could also remember to mute your phones, and when you do come up to testify, remember to identify yourself and make sure that you've pressed the microphone button. For those of you on the phone, again, we'll do a similar rotation. We're going to start in Las Vegas for testimony today, go to Carson City, and then come back to the phone. So this morning, as noted, I'm down here in Las Vegas, and we have Joseph Thiele up in Carson City, our management analyst assisting with logistics and research, and Kelly Bowen, one of our master services agreement contractors, assisting with the needs assessment, including research and design of the operational program. Before we get into the specific agenda items, is there anybody that wants to give some general public comment before we get going? Here in Las Vegas, general public comment not related to the agenda items. Up in Carson City, anybody want to give some general comments before we get into the agenda items?
No one here, Marla.
And anybody on the phone, general comments before we go into our agenda? Okay, so we did have, again, the handout for today is the outline of discussion points, medical marijuana establishments, dispensaries. That's what we'll be working from. The purpose of this meeting is to allow an opportunity to see some proposed language for regulations required pursuant to Senate Bill 374 of the 2013 legislative session. So I'll go through the document and then we'll open it up for testimony for any items specified in the outline. As indicated, we'll take testimony first here in Las Vegas, then Carson City, then on the phone. Again, the purpose is to open up dialogue where you support someone's comments. That's helpful, if it's something significant that we haven't already discussed. If you disagree with someone's comments, again, having an alternative that we can consider as we move forward is very helpful. The goal of all of these sessions is to try to get to consensus on language and concepts. So the more that everyone can work together and agree on anything that's contentious, the better off we'll all be as this moves through the process. Again, just remember to turn on your mic and identify yourself. For those of you on the phone, if you could take some time to clearly identify yourself before you give your comments, that's helpful for us as we record the meeting. So again, the meeting is being recorded. We do have copies of the recording would be available through the legislature's publication site. And as you know, we're not debating. Please mute your line. Those of you on the line, if you would just please mute your phone. So we are not here today to debate the merits of the bill. We did find last week that we have some differences in opinion on what is required of the bill or how we might move forward on interpretation. We've taken all of those under advisement, and working with our Deputy Attorney General will come forward with what we as an agency believe we're required to do, and we will let you know that once we've concluded those things. So again, if I could remind everybody joining on the phone to mute your line. If you have trouble muting your line, if you could just disconnect until you can figure out how to do that. The callers on the line, I'm sure, would be very appreciative of that because it really disrupts their ability to hear the call. And again, if you have your phone here in any of the audiences, if you could put it on mute as well, we would appreciate it. So beginning with the handout, again, this is a session designed to identify the unique provisions related to dispensaries. On line 2, subsection 3 requires a consulting physician and requires the proposed hours to be declared for their dispensary. Beginning at line 10 of our larger handout, paragraph 1D requires the Nevada license number of the consulting physician, and paragraph 1E is a redundant section requiring the proposed hours of the dispensary. Line 20, as it relates to the electronic verification system for non-resident card holders, there's currently no model to follow, so anything that we can get specific to that would be very helpful for us. At line 37, it's a redundant section, as well as is line 44. And again, as a reminder, the redundant sections are there to help us ensure that we're meeting the requirements of the bill. So as we went through and identified specific bill requirements, we identified sections where we had suggested language and plugged it in there. So that's why this is a working document and we have some of those redundancies. At line 63, it requires a medical marijuana establishment to designate a person responsible for oversight of the establishment's inventory control system, specifies from whom an establishment may acquire marijuana, requires establishment of an inventory control system, requires audits of the establishment's inventory, and specifies the period of retention, as well as requires documentation to be provided to the Division of Public and Behavioral Health upon request. For those of you on the phone, if you could remember to mute your line. Going back to line 68, paragraph 2D requires a report to the consulting physician of the dispensary if an agent experiences an adverse health condition. Paragraph 3 prohibits an agent from having direct contact with any medical marijuana or equipment until the consulting physician determines the health condition will not adversely affect the products. Line 69 specifies requirements of a dispensary as it relates to dispensing medical marijuana during its designated hours of operation, requires arrangements with the consulting physician, and requires posting of information related to the name of the consulting physician and the hours of operation. Line 70 specifies the responsibilities of the dispensary as it relates to dispensing medical marijuana to patients. Line 71 specifies the labeling responsibilities of the dispensary. Line 72 identifies responsibilities concerning certain aspects of the physical environment and the equipment of the dispensary. Line 78 is a redundant section. Line 85 identifies the responsibilities of the division as it relates to notifying a dispensary if a patient designates a dispensary. Line 87, as it relates to setting, please mute your line.
Hang up your
Those
phone.
of you on the call, beginning back at line 87, as it relates to setting forth the amount of usable marijuana a dispensary may dispense in any 14-day period, there's currently no model to follow, so we're looking for input there. At line 89, it's a redundant section, and then finally line 92 identifies certain minimum training requirements for agents of dispensaries. And as we indicated on Friday, that also is an area where we could use suggestions about specific training requirements for agents. If you can mute your line, please. Everybody on the phone, if you could mute your line, we will go ahead here in Las Vegas for public testimony and comments. So just go ahead and come on up and remember to identify yourself and turn on the mic.
Good morning, I'm Karen Becker. Throughout some of the regulations and in the bill itself, there are different terms used. And so, for example, in line 2, when we're talking about a consulting physician, here I believe what we're talking about is the person who's going to be an employee of the proposed dispensary, grow facility, etc., as opposed to the physician who's issuing a medical marijuana card for a particular patient whose office may be outside of that dispensary. So I want to make sure that that's clear and that we think about what that consultant physician's role will look like.
Whoever
For
that is,
example,
please hang up their phone.
For medical laboratories, for physicians' offices, for groups of practitioners that work together, they have what's called a medical director. And this person is in charge of the overall medical facilities, can be a consultant, may or may not be someone who is there on a daily basis. There are certain requirements that they be there once every 30 days in some situations, or more often as the case may be. So I think that's something we should all kind of think about going forward, what that role is going to be, so we're all sure who we need to hire and how to best serve the patients. Also, this is more of a definitional thing, but in line 68 and throughout some of the things that we spoke about on Friday, in certain places the word agent is used. The bill talks about owners, board members, officers, and employees. And I'd like to know if there's a specific reason why agent is used instead of employee, and if so, what does that mean? Okay, thank you.
Thank you, Ms. Becker, for your comments. I did want to pick up on your comment related to the consulting physician. So as you know, we modeled this after Arizona's regulations. Arizona's regulations focus on a medical director. We consulted with our state medical director who felt that designating responsibilities of a medical director in a dispensary weren't necessary at this time, just based on some of the science and what would the role be. So you are correct that when we refer to consulting physician, it is a consulting physician for the dispensary. It is not the physician of the card holder who made the recommendation for the card holder, but it is someone specific that a dispensary would need to have access to, who can advise them, as indicated in one of the sections, if an employee is sick, is that employee contagious? What are the other conditions that might prevent the employee from being able to handle product on any given day? But it would be open to the dispensary's needs. We're just going to require that there be a consulting physician and that it's open to the dispensary's needs as it's needed. So you don't even need to employ a physician for the dispensary at this point. At least that's what the current proposal is. As it relates to agent, I'll look into that. It is meant to be the employee, so we'll just verify that. Thank you. Go ahead.
Good morning. Vicki Higgins. As I perused the bill, or the information here, I do see the physicians seem to be penalized if, say we've got a lot of physicians in town that are open to signing medical cards at this point in time. Many are not. The fact that they may be penalized if they sign too many, there's no definition of too many. I think we need to take into consideration the physicians that have been operating in this capacity are going to be signing more because people will be coming to them more. As we go through the bill, I noticed that there's no sanitization procedures in any of the establishments. I think we should establish a food quality sanitization procedure to assure safety and quality of medicine. There is no handicapped access parking or restrooms required in any of the paperwork that I've read. The training for people to work at the facilities, and this includes all of them, I think needs to be considered to be implemented ahead of time, as do the grows and production areas, because of the preparation time needed and to be prepared when the dispensaries are in fact open. And this brings me to the home grows. We've discussed the one-time only thing. I highly suggest that 180-day cycle is a grow cycle that accommodates the curing of the product. And if the patients at home are following procedures, they can take their medicine, and I think any medicine should be delivered to the quality controlled centers in a sealed packaging, have it checked. The quality check should be completed, and then these items should be sealed, stamped, and numbered. There should be lot numbers on each one of these quality checks. And as these products move through the production centers and then into the dispensaries, I feel that these lot numbers should be on every item that comes from that lot of medicine and who quality control and checked it. I think these items need to be tested how many times per batch if we're talking cannabis. And if we're discussing tinctures, oils, lotions, I think the testing needs to be specified as to how much, say, per unit, if the item is packaged per unit for sale, that unit amount should be specified to be tested on each individual items. I do highly believe that caregivers should be allowed to be patients. As a patient, you're more knowledgeable about the medicine, its qualifications, et cetera, et cetera. Caregivers not being allowed to be patients really eliminate a lot of caregiver options because there's not many people who aren't patients who are willing to do the work effort and put the time into assisting a patient. There are those out there, of course, we're aware of that. I think the quality control should be sealed from the quality control center to the establishment, and then it should be sealed if it's being delivered to a patient. The delivery services, I believe, should include 2 drivers or 2 people on each delivery. The meds should be in a locked, secure location. One person should stay with the vehicle at all time. I would suggest that one of the people be a registered security in some way, shape, or form to assure the security of the delivery driver and the patients receiving the medicine. Thank you very much for your time and your willingness to work with the community. We very much appreciate it.
Thank you, Ms. Higgins.
Good morning. I'm Attorney Bruce Gale. First of all, I want to commend you and the division for your Herculean task and what you're trying to accomplish and what y'all have done so far. I've been working with Attorney Mark DeBeek, and what y'all have done has been short of phenomenal, and keep up the good work. I have just briefly looked at item line 63, and I want to discuss that very briefly. I haven't had an opportunity to look at the other line items this morning yet. That's the first one I've looked at. And regarding line 63, specifically subsection 2, it reads, a medical marijuana establishment shall only acquire marijuana from, and I'm concentrating on the word marijuana. I have NRS chapter 453A with me. I didn't get a chance to look at it. I don't recall that there being a definition of marijuana, but I'm drawing attention to this regarding the seed, I guess the seed issue. Maybe the word marijuana should be specifically defined. I know under Nevada Administrative Code, usable marijuana was defined, and that's changing effective April 1st, 2014, where an individual can possess 12 plants, and it's abolished the distinction between mature and immature plants, and that kind of relates to the division's contemplation of licensing dispensaries and testing laboratories first and to allow for a growth cycle. And then you read subsection 3, subsection B, and that reads when acquiring medical marijuana. So maybe the division should maybe define what medical marijuana means. Again, this might clarify the issue of what was discussed on Friday, and the acquisition of seeds for cultivation facilities to legally obtain the seeds and initially get this the system and the supply issues resolved. So that's all I have at this point.
Thank you.
Thank you.
Reminder to those of you on the phone, if you could remember to mute your line. Anybody else here in Carson City? in Las Vegas.
Good morning, Derek Connor of the law firm of Connor & Connor. I have a quick suggestion with regards to the consulting physician for the medical marijuana dispensaries. And it was mentioned earlier that perhaps this be a requirement for a dispensary to basically have an on-staff employed physician. I would like that to be read that there is no requirement they have to be an actual paid employee under the dispensary, but perhaps just an outside independent contracting doctor or somebody they could have on retainer as the consulting physician. And that's about it.
Thank you.
Thank you.
Good morning. Ralph Wenger, Las Vegas, Nevada. As we start getting closer to the development of an interstate authorization or verification system, I just want to make sure that that process will be pretty clear. I know there are a lot of people that can help us bring that information into a central terminal, if you will. And I just want to not be surprised by what that is or how it's going to work. Is there someone heading up that process or a department right now?
We currently have not worked through that piece, but.
Thank you so much.
Okay.
Oh, and as far as the doctor go, there seems to be a consulting doctor, and as you spoke, the clarification of this person being a consultant to a dispensary, someone that a sick individual could be referred to, or an employee or a agent of the dispensary can be referred to, meaning more of a practical physician as opposed to a consulting doctor as far as the medical uses of marijuana.
This is Marla. I'm not sure that I'm tracking on that, but again, I think we envision that the cardholder has a physician. That physician should be aware of the issues of the cardholder. And as it relates to a marijuana and what a physician could provide in terms of a service to a dispensary, then you're really looking at their different levels, their different responsibilities, I guess, and different roles. But as a dispensary, you really don't want to get into the business of patient care. You want to know what a patient's condition is and what product you have that might be beneficial to certain conditions, and that working with a physician on those types of things. Or again, you have sick employees, and at what point should those employees be pulled off of their current duties to assist. So focusing on the needs of the dispensary versus the needs of the patient, I think that really should be the distinguishing role.
So I see two different doctors, if you will. One is a consultant for the medical marijuana dispensary as far as the use of medical marijuana, the practical application, and I hope that won't be. That would be more of a consultant, where the physician that we're speaking of is a hands-on person that could tend to our staff if we're in need of physical medical attention.
Yeah, I think they could conceivably be the same person. The key is, one, that they be a Nevada licensed physician, again, working for the dispensary. And then, as you have an agent and you've got a patient coming in, and the agent says, is this really helping you? Maybe you're not feeling better with what we're giving you. Then being able to reach the consulting physician, we've worked with this person, here's how many times they've been in. Is there something we should advise them? Should we advise them to go back to their physician maybe? Or it's having that type of role. So you're in the dispensary as an agent, working with the patients, identifying issues, getting your consulting physician saying, how do you recommend that I move? How do I advise this patient to move forward? So I think that's what we're envisioning with it.
Thank you. And the last point I want to address is employee and agent education. Is this something that you see being handled directly by the dispensaries, or and that program being in check through the application process, or do you see an outside agency, whether it's private or state, that will be training the licensed medical marijuana agents that we're looking at adding to this group? Thank you.
Thank you. That's a good question. The way that we intend to lay it out is we intend to lay out the minimum requirements that a person would need to have been trained in. So it could be, the dispensary could provide the training, or the other, as you know, all four different establishment types could provide the specific training, or as happens in other industries, I'm sure there's a private sector entity that would come out there, develop the curriculum, and all of those employees start going through some outside entity. The state is not intending to be the trainer. We intend to lay out the requirements, and then the dispensary demonstrating to us how those requirements have been met.
Hello, I'm Jennifer Solis. I'm a 10-year educator in veterinary nursing and a 5-year educator in cannabis. I have a social group. I'd like to address 2 points. The system for verification and non-resident card holders in line 20. Currently, Colorado is working on a centralized swiped system, and linking to those systems, I think, would be very helpful. And then the speaker that was right before me talking about an outside educational facility to educate workers, we are developing a curriculum and a syllabi for that type of training also. And I'll give you my business card to talk about that. But the electronic verification system and non-resident card holders, there's no current model to follow, but it would have to be linked state to state somehow. I'm not sure if California has a linking system where they know all of their patients, but that would be something to look at. And thank you for your work. And that's all. Thank you.
Thank you.
Hi, Vicki Higgins. Excuse me. At the legislation, it was discussed that an affidavit be signed by out-of-state patients at this point until the electronic verification system is up and running, and until such time as other states are adequately linked in with our system. I'm wondering, it says that these establishments are subject to inspections. Who specifically will do these inspections? Will the whole team come in and check it out? Is there going to be somebody assigned specifically to do that job who is educated and knowledgeable about these establishments and what's required? And speaking of education and the lack of in our public and our police and our judge system, and just the education of the public in general, especially police, judges, and people who have to deal with this situation intricately, I feel that there really should be some sort of something set aside to educate the officials of our state so that everybody's aware what's going on. We've got judges and police in other jurisdictions or counties that aren't even going to allow. How are we going to accommodate these counties who choose to opt out? There are going to be patients in those counties who have needs. I discussed with a patient called me in distress. They have a card, but the sheriff of their town indicated to them if they were even caught growing that he would not honor the medical cannabis issue at all. He did not find it to be legal. I have a patient who has a child that has been taken away. Child was thriving in his care. But the fact that the judge tested it as a medical cannabis, and yes, we need to work on that at the federal level, I'm well aware of that. But my concern is the education of these people. This judge will not in no way, shape, or form acknowledge that medical cannabis is legal, and that this gentleman was not intoxicated. He had medicated with a cookie the weekend before. And because of his nanogram levels in his blood, as a cannabis patient, I wake up in the morning with a higher nanogram than the random person who takes cannabis and then gets tested. I'll probably test just as high in the morning if you want to say the nanograms and the blood levels are high. I feel that it's really important that we establish some sort of real 12-hour test, a swab test, to test for intoxication. We have employers and in many other situations, parents, who are going to test positive even 20 days after they've medicated. So I think that's something that we really need to address. In reference to the people behind the counter at the dispensaries dispensing information as to what strains might work best for them and that type of thing, there has been some concern that these are not trained physicians. They're not pharmacists. I do think that basic training outlines and generalities is a very good thing, but I think that charts defining different levels of the different effects and all the different details be posted in each of the dispensaries where the patient themselves can view them in addition with the person showing it to them. One last thing, to track the effects. We had discussed HIPAA violations throughout, and to track the effects of cannabis on a patient in conjunction with their records that are being kept for the state is definitely a HIPAA violation. I would suggest that if we're going to track the effects of the medicine and how they're working for the patient, that this be done in a manner of a blind, non-named type of file separate from the patient confidentiality files. We have HIPAA violations left and right. This particular information being available to the division. And also, the doctors as a board member or ownership, I know I'm not an attorney, but I find that very unclear. If we need a doctor on board for our community or for our establishment, how exactly do the doctors play in as a consultant? It's been discussed not to have one on site, but it's unclear. And as I said, I'm not an attorney, so thank you very much. The importance of educating doctors is back to the having a signature to make sure you're healthy enough to work in a medical cannabis establishment. The average doctor may not have an idea about that, and I do feel that we need to work with their departments to educate them in that sense. Thank you very much for your time.
Turn off the mic.
Oh, pardon me.
I just would like to respond to your question about who will be doing the inspections. So we see that as being the role of the Division of Public and Behavioral Health. We are right now, parallel to this process, developing our operational budget and our physical structure that will actually oversee the medical marijuana establishments. As indicated on Friday, Chad Westham is our bureau chief that ultimately gets to go in and regulate the actual establishments. So we will be sending the team of people in. That is also a public process that the legislature needs to approve for us once we have that proposal to move forward. So we are developing the types of positions that will do the oversight. At the working document you have before you indicates that we will inspect on a yearly basis and we will inspect to complaints. So those would be the triggers for actually coming in. So just in response to that question. And I think it is helpful if you want to get on the record, if you are opposed to prohibiting a physician from having ownership in the facility. I think, Ms. Higgins, I think that's what you were trying to say, that you don't agree with that. So if you're opposed to it, just go ahead and say that. It won't hurt our feelings. We just need to be able to hear from you about, how you feel about those things. So we don't get to the end having somebody come forward and say, well, I don't think they should prohibit physicians, but they didn't take them out. But we didn't get it clear from everybody that that's what you wanted. So you have to be very clear. We're trying to take what you're saying and move forward from it. If you're just flat out opposed to something, just say it. And it won't hurt our feelings. We'll work with you all on it. Okay? Go ahead.
Attorney Matthew Schneider, Las Vegas. Going to line 14, I think some of us are hoping to get more of a working definition of agent, specifically as it refers to a contractor. If we have outside contractors servicing a facility like waste management or even a plumber or electrician, in order for them to contract with an establishment, would they need to go through the process of getting a card? And specifically, would it be the company as a whole or the individual employees of that company that would actually be coming to the facility?
Thank you.
Ralph Wenger, as far as the inspections goes, you might look at the model of the cosmetology, Board of Cosmetology. They run an inspection department that is pretty inclusive of both health aspects and ambient safety.
Thank you.
Good morning, Derek Connor again. If I can just follow up on the statement from the gentleman that just spoke previous to the last about having contractors working inside the medical marijuana facilities. I know other states have gotten a plan or a system put in place where they simply fill out a visitor's ID. You take a copy of the person's ID when they show up, and then you hang a visitor's pass on them, and they're allowed to access the spaces that have medical marijuana. I would suggest following a similar plan here in Nevada. That way we can have people come back and service the equipment and stuff.
Do you have specific states?
Colorado. I know Arizona does it as well, so I would look at their whatever their rules and regulations are out there. I'm an attorney here, not out there. Thank you.
Yeah. Can you turn off the mic?
Sorry.
For those of you on the phone, if you could just remember to mute your line, please. Thank you.
Good morning. Again, Attorney Bruce Gale. I want to discuss very briefly the issue regarding doctors having an ownership in a medical marijuana establishment. I believe there's nothing in SB 374 that precludes a doctor from having any type of ownership or being an officer, director, employee of a medical marijuana establishment. And in fact, a doctor as a partial owner or officer director could be a benefit when the division is looking at the applicant's application, and the factors regarding the educational background of all those individuals. So I don't think a doctor should be precluded from having an ownership interest in a medical marijuana establishment, and that's something that the Division of Health should, in its discretion, determine whether or not that's a benefit to the applicant and whether they should receive a medical marijuana establishment registration card or registration certificate.
Thank you. Anybody else here in Las Vegas? Go ahead.
I can only speak for myself, but I do see a potential. I'm Joshua Stillman. I do see a potential problem with the doctor having a medical marijuana dispensary, in that now the doctor isn't just a doctor. Now he's somebody that's giving somebody medication, which is something, from what I understand, I'm not a doctor or a physician, but I understand that a doctor can't own or operate a drug company. Why would we allow them to do that with a medical marijuana shop?
James Dean Levitt, Las Vegas, local attorney. I don't know how constitutionally you could preclude a physician from owning an interest. I think if you look at the merit criteria, which has already been outlined in SB 374, it gives a preference to people that have medical backgrounds. So I can't imagine that that would not be of a benefit to that entity or to that group. And then I just had one unrelated comment, and this may or may not be the right time to say this, but you're giving a 10-day period in which applicants once a year can apply for these various licenses. Are you going to allow additional people, whether it's for financial or other reasons, to participate in these entities? Will they have to wait 1 year to become a member? Some of these businesses, in fact, I'm going to say, when I look across the country, there's a high percentage of these businesses that fail. You can look at businesses in general, and the percentages are within 3 years. Majority of businesses fail. I would suspect it's even higher for marijuana businesses, although I can't cite research specifically in that regard. But so my question is, there may be the necessity for other people to come in, other investors, regardless of which license that you're applying for, and are you going to make them wait an additional year if the business's survival is necessary on someone coming in with cash to make the business work? Thank you.
Thank you.
Morning. Jerome Snyder, attorney. I think that in consideration relative to doctors being licensed within medical marijuana establishments, you should differentiate between the different identities. For example, the cultivators versus the dispensaries versus the laboratory. In a laboratory situation, I believe you're going to want to have a medical doctor involved. Thank you.
Karen Becker. My review of the regulations in the bill, it looks to me as though on the first tier there is no prohibition for a doctor being an owner or a board member, but I think what the point that's trying to be made when you look at the draft of the regulations in terms of denial or renewal or denial on application, I think you're looking at the type of physician who's issuing medical marijuana cards currently, as in before any of this starts, prior to April 1. And I have no comment on whether that is something the state would like to have those doctors be an excluded class or not, but I think there's a difference between having other doctors who are in the community being owners or on the board. Thank you.
Anybody else here in Las Vegas?
I'll try and be as short as possible on this. RJ, owner-operator, Arizona Dispensaries. I have no opposition whatsoever in the doctor owning a dispensary. It's just in Arizona, the doctor's role has been slightly overstated. It's somewhat of an undue, unjust burden on a dispensary to enroll and employ a doctor, especially when they charge in Arizona in excess of $2,500, $5,000, upwards of $7,500 a month. And we've done thousands of transactions in our dispensary at this point, and we've had one phone call to this doctor. A doctor can essentially assist, I'd say, to guesstimate 5-10 dispensaries at one time. In Arizona, they're only required to be accessible by phone. To have a doctor on site would be a complete waste of the doctor's time, let alone the undue justification of cost to the dispensary. It's extreme. I mean, you're talking $60,000 to $100,000 a year to have somebody sit there and really have no role in the dispensing of the cannabis. Like I said, one phone call, and it was a simple older woman, 80s, a simple drug reaction that wasn't even occurring. Doctor cleared it up in about 30 seconds. That was the extent of his $3,000 a month cost. So just clarifying that and just some on-the-ground applications in Arizona at this point. Thank you.
Hi, Kay Swanger. Just a couple of comments and maybe some suggestions of things to look at. In the healthcare industry, there is a movement underway referred to as consult-a nurse and consult-a physician. And that allows for some individuals with great credentials to be available via telephone or a telemedicine arrangement using technology to allow for that individual nurse or physician to provide consulting services to a wide array of people, but not have to be actually employed. And it sounds like there are other areas where you're considering outside consulting services that could be leveraged by dispensaries or even the cultivators. And that might be an option for you to consider. And then in the healthcare industry as well, there is a law that is available nationally called the Stark Law, which defines very clearly the role a physician can play in healthcare organizations. Yet there are exceptions that are made when a physician decides to maybe create a boutique surgery center or a boutique hospital, and those situations may provide you with some guidance on how to move forward here.
Thank you.
And not to cite any specific lines, just to go back to the comments on the dispensary agent cards, again, RJ, Arizona. The challenge we have in Arizona, that it's a little bit ahead of its time to state it right now, but hiring employees, and Arizona charges $500 per dispensary agent card per employee every year annually. So The challenge is that we've fired 4 employees at this point for specific reasons we have written down, but it would be super beneficial to have a preliminary trial period with an employee before you pay the fee for that dispensary agent card, so you can evaluate them, make sure they're the right fit for the dispensary, and then go on from there, because we've hired them and then 2-3 weeks later, after we go through a 2-week process of fingerprinting the entire background check, going through the state, you're just wasted $500 on a simple employee. That's one major challenge. And then, not to use the word abuse is a bit extreme for Arizona, but we hired a third-party security guard through a firm, and they wanted us to get their dispensary agent card for that security guard at $500 through a third party. He never actually enters the dispensary, so I see his role and his function within the dispensary, but and they have a team of 10 guys, that come on different days of the week. To get a $500 card for every one of those security guards was quite ridiculous in my opinion, but you have nobody to argue the point with. So just the correct use and the application of the dispensary agent card specifically with a slight time frame, and then the fact is who actually is handling the meds is your actual dispensary agent in charge of anything that has to do with the actual cannabis would be super helpful. Clarification on that in the future. So thank you.
On the line, if you could remember to mute your phone. If you do not know how to mute your phone, if you could please disconnect and then dial back in once you can figure that system out, we'd appreciate it. Anybody else here in Las Vegas? Okay, let's go down up to Carson City, please. Joe, we don't have any. Oh, there we go.
Hi, Shane Johnson, Washoe County. I've got a number of comments here. First off, just I think as a partial rebuttal to an earlier comment, there was a comment made about the desirability for a delivery service requiring 2 drivers. I think if the point of this entire legislation is to provide a service to medical marijuana patients, that adding the onus of 2 drivers to simply deliver a medication is prohibitive from a cost perspective. So that doesn't make a lot of sense to me. I mean, all it does at the end of the day is increase the cost to the patients. The rest of my comments I'll preface by saying that I am a trained physician. I am not a practicing physician, but there have been a lot of comments today regarding consulting physicians, regarding physicians as owners, et cetera. So I wanted to put that out there. In terms of physician owners, obviously I am a trained physician. I am interested in being an owner of a dispensary, among other things. The conflict that I can see potentially is if the physician who is a physician owner is actually the physician who is prescribing medical marijuana to patients. So that can be a conflict, and I think any ethical physician would not want to put themselves in that position, but if there's a legislative approach to clarifying that as well, I certainly wouldn't have an issue with that. In terms of, let's see, line 88, 1E, there's under patient education and support, there's a requirement that there be a method of tracking the effects of particular marijuana strains, et cetera, on patients. I don't see how this is a dispensary function. It seems more of a patient care function, and to put that burden on a dispensary I think there may be HIPAA violations. I think that you're getting into practicing medicine, which the dispensary should not be doing. So I don't believe that should be a requirement for the dispensaries. I would reiterate a comment made earlier, which has to do with line 91. It's just the tracking and the discipline for prescribing physicians. I know that this is partially in the actual law, but I would just comment that identifying what is an quote-unquote unreasonably high rate of use or prescribing rate is going to vary greatly by doctor. If you're a doctor who sees mostly cancer patients and is open to prescribing medical marijuana, you could have extraordinarily high rates of prescribing. If you're a pediatrician, I would argue you shouldn't have very high rates. So I'd like to see whatever can be done to modulate that there be some tracking mechanism in place or punitive measure in place, and really have it be, that's between the doctor and the medical board. And I know that some of that language is in there, but where the division comes into play is a little less clear to me. With regards to consulting physicians for the dispensaries, I still, after hearing all of the commentary today, am a little bit confused. And I appreciate the clarification that there's a consulting physician who is not intended to be the prescribing physician. I understand that on the one hand. I mean, a desire to have somebody who can oversee dispensary agents, who maybe have a question about their health or what have you. But I don't know that there's a similar requirement, for instance, on a restaurant. I mean, if, people in the kitchen are cooking food that people are, diners are eating, I don't think there has to be a consulting physician for that. So to me, everybody should have their own physician. And if you have a health concern, obviously if you're sick, you report that in to your boss. And if you're sick, you shouldn't be going into work. But anyhow, I'm not too adverse to it, but I don't really understand what the intention is there. I do have an issue with publicly posting the name and license number of a physician. I think that implies that the physician who is a consulting physician is somehow there for the benefit of the patients who are coming to fill prescriptions. And no physician is going to want some random person who they've never known before to be calling them. Similarly, there was a comment made, and Marla, I actually think you talked a little bit about the role of the consulting physician to be to advise agents at the dispensary on some of what they should be thinking about with regards to the patients. I really have I think that's a challenge. I think that if there are any questions with regards to the medical use of marijuana, it should be a discussion between the patient and his or her prescribing physician. There shouldn't be somebody else. No doctor really is going to want to get involved with a patient who they don't know, or advising a medical marijuana establishment agent with regards to a patient who they don't know. So to me, that should be a very clear separation of function. Thank you very much.
Thank you, Mr. Johnson. I appreciate that. I guess, maybe where we're going is there any need at all to have any physician accessible to the dispensary? So if you could maybe all weigh in by email or something as opposed to today, but what is the balance? I don't know what it is. Again, we modeled this after Arizona. They had a medical director. We've determined we didn't feel that was appropriate. We thought maybe a consulting physician was the option, but maybe there's no physician. And again, it won't hurt our feelings, but if you can weigh in on email with that, we would appreciate it. Assemblyman Horn here in Las Vegas.
Thank you, Marla. Just for some clarification, a little bit of background, I thought it was important to note that on the issue of tracking the usage for patients on particular strains, there was, I can appreciate the concerns on HIPAA violations and everything, and also full disclosure, I am also, as a member of the State Assembly, I'm also a practicing attorney here in Nevada. There is an issue that we went over in Interim Finance Committee dealing with the study of medical marijuana that was supposed to be taking place at UNR. It was a mandate, and risk of oversimplifying it. There was, it hasn't been done, probably due to lack of funding to do that. But maybe that there's an opportunity here to have that tracking, if that is, part of the legislation, to do the tracking, but to have it done in a clinical sense with the university. And I think you might be able to overcome any issues with HIPAA violations in that and still get the appropriate data that policymakers were hoping to receive with their decision to legalize this and create these dispensaries. And so it's just a suggestion to help the process. Sorry for taking it out of order, Marla.
Thank you very much. I think we all appreciate that clarification, though. Thank you. Let's go back up to Carson City.
My name is Doria Shoemaker, and there were some good comments made. I'll start with the foremost one about having a physician on site. Seems like a burden, and as it was stated, an extra cost. Possibly it did make sense maybe to have one accessible by phone, but having one on hand did not make sense. And also I wanted to refer to having dispensaries track to prescribing MDs seems like an unnecessary burden. If the state wants to track the prescribing MD, then the state should process that information at the patient registration card level. Medical pharmacies do not track to prescribing MDs, and so why you would have marijuana dispensaries do that. Let's see. And it seems like it would be scrutinizing MDs and putting them under the microscope and possibly intimidating them for even prescribing medical marijuana. And I know some physicians won't do that today, prescribe to cancer patients that really need it, and because they don't want that extra scrutiny, and possibly having their license revoked. And it seems that the state might be underestimating the number of MDs that will be prescribing. Prescribing marijuana will be, I think, more of a commonplace in the near future, and tracking the prescribing MDs could slow the process. And I wanted to get back about the comment about having the ethical or financial conflict between physicians owning a dispensary. And the state of Nevada has statutes which prohibit medical doctors from having financial interests in pharmacies, imaging facilities, and pharmaceutical companies due to potential conflicts of interest. However, it was brought up that I do agree if you aren't a prescribing physician, then that makes sense that you could own a dispensary. So whatever terminology could be used there. And I wanted to reiterate from Friday that this licensing should be kept in to Nevada residents only, and keeping those finances and money within our state, so it doesn't end up being big businesses, monopolies, and franchising to out-of-state business groups. Let's see, limiting the number of dispensaries is smart, but using the proposed equation of one medical marijuana dispensary to every 10 pharmacies may not be the best metric. The state might be underestimating the demand for medical marijuana, and perhaps a different metric could be used for the number of dispensaries. That is it.
Thank you.
Shane Johnson again, just a very brief comment in response to what was just brought up with regards to clinical trial. I'm fully supportive of studying the effects of marijuana, the clinical effects of marijuana, and getting a better understanding or developing a better understanding as a healthcare medical community with regards to what specific strains will do in certain disease states. So from the point of view of a clinical study, I think that would be fantastic. Most clinical studies are opt-in by patients. So if that would be, in my view, UNR or whomever wants to actually do the study, or whatever physicians would want to do the study, putting them in communication with the dispensary owners and enabling those dispensary owners, I think on a voluntary basis, to really have it be functional and copacetic. But I, for one, would be very enthusiastic about offering people who came in the opportunity to enroll in a study and helping to track that. It would be of great interest to me to do that, but I think it should be voluntary, and I think it should be run as a clinical trial, and I view that very separate from the dispensary having a mandate to actually track the patient's response and the efficacy to particular strains and dosing, et cetera, for medical marijuana. Thank you.
Thank you. Anybody else in Carson City? While we're waiting, we'll go with one more comment here in Las Vegas.
Ross Goodman, I'm a lawyer in Las Vegas. When we're drafting the operating agreements, and if a manager, if pursuant to the operating agreement, a manager needs to be replaced, how do we replace that manager? Do we have to give notice to the state? Do we have to wait a year? So in other words, if the business is in jeopardy because of conduct or actions of the manager, the members of the LLC will have to replace the manager in order not to put it at jeopardy. So we'd like to know how to draft those operating agreements to take that into consideration.
Thank you. I think we would model it. We regulate health facilities as well, and so we recognize when there's an administrator that changes that you need time. So you provide the notice to us, but you do have to work through and make sure that that person meets all the requirements. So we will work with you. It's not a one-time only thing, but it would be an ongoing. We just need to make sure that in the regulations that we write it that way so that it's clear. Thank you.
Thank you.
I would like to continue with Carson City if I could.
Thanks, Marcia. This is John Sutton from Washoe County. First, a high-level statement. One thing I've observed in researching this business opportunity to serve the patients in Nevada, I want to just make a comment that from my perspective, I don't think I've ever met a more gregarious, social, and friendly community pursuing any business model as I have this one. And I have worked globally for some very big companies and then across several technology startups. So it's actually fun. But a couple things I want to talk about. One, determining whether a physician needs to be in situ or even retained through a consulting agreement. I wanted to make the point that when I look at this, maybe I look at this whole opportunity through a different filter. When we're talking about the efficaciousness of a strain against a medical condition, I actually see that as an opportunity to crowdsource those answers. And if anyone is unfamiliar with that, what that would mean is medical marijuana patients and dispensary owners and cultivation owners across the states that have authorized medical marijuana certainly could be working together to determine how a certain strain applies against a certain condition. And those things could be truly offered as an ancillary service at a kiosk up front where someone could go in, input the condition they want to address, and you could crowdsource or aggregate those answers across thousands of medical marijuana patients. While it may not be medically approved, those answers, it would be anecdotal based on real-world experience. It'd be something that I would consider implementing, assuming that we get approved here. The other one is the inventory management control systems, and across the supply chain, the various technologies that you envision us leveraging. One of the concerns that I have out of the gate, when I look at the group in here and the group in Las Vegas, ultimately we want to work together as seamlessly as possible. We want to be communicating effectively with each other to really protect each other's interests while at the same time making sure that we're addressing the needs of the medical marijuana community itself. I have a concern when I look at this problem whereby if this was not the state of Nevada and we weren't talking about medical marijuana, but we were talking about just building a business opportunity in another vertical, if you will, there's going to be a pretty significant problem if everyone in this room and that room and on the phone goes out and buys disparate technologies to address inventory. The communication of technologies is not as seamless as some might assume. The work in APIs, application program interfaces, are going to be very complex so that our systems are all talking to the state and potentially even intrastate systems. So if we can land on the buying criteria for these technologies, to be able to source that technology from the state, if the state was the buyer of it, would certainly streamline cost across the ecosystem of owners, while at the same time guaranteeing that we could all communicate with each other. So that whole aspect of what you're looking to accomplish needs a lot of focus. Otherwise, we'll end up with 50 different systems communicating in 50 different ways and presenting data and output that might not even recognize each other. So I'd be happy to work on that as well. And so again, in the two things I see, technology solutions for the aggregation of medical recommendations as it relates to strains. And I'd love to talk about crowdsourcing in more detail. And the second one, making sure that we have some unanimity, or actually a cohesive solution as it relates to the technologies that you're requiring for us to do business. Thank you.